Do you have any symptoms like unexplained weight loss, loss of appetite, persistent fatigue or tiredness, or any unusual lumps or swelling in the body? Probably these might be one of the symptoms of the or early signs of the cancer. So, if you have any such symptoms, watch this video till the end and know what to be done when you have such symptoms. Hello everyone, this is Dr. Aravind. This is the part 4 video of the cancer awareness series where we will be discussing about the common symptoms of the cancer. So this video can be divided into 3 parts, like one is the common general symptoms of the cancer, followed by the specific symptoms of the cancer, and what are the things that should be taken into consideration that when you have these specific symptoms. So what is a symptom? A symptom is the body's warning sign that you have some issue within the body. So this is an early warning sign for the body. It is alerting you that you have some problem within. Okay. So let us understand what are the general symptoms of cancer. As I have already told, unexplained weight loss. It is a significant weight loss, which means losing 5% of your weight within 1 month, or 10% of your weight within 6 months. For example, let us assume that you are 60 kgs in weight, and if you lose 6 kgs over a period of 6 months, then you might have cancer. If you are 90 kgs in weight, if you lose about like 9 kgs in about 6 months of time, 6 to 12 months of time, then definitely you might be having cancer. So for example, now you cannot ask me like if someone loses weight voluntarily, or if someone is suffering from specific illness because of which they lost weight, then it's definitely not, right? So, and loss of appetite and persistent fatigue or tiredness, especially in anemia, due to ongoing blood loss in some way or the other, they might experience persistent fatigue or tiredness and unusual lumps or swelling in any parts of the body, either it is neck or breast or abdomen or wherever it is, okay, right? And changes in the bowel and the bladder habits, which means like alternating constipation and diarrhea, persistent cough or hoarseness, or the change in the voice. Then there is difficulty in swallowing, especially when there is a cancer related to head and neck. Then these cancers are in the area of the swallowing, then we might experience dysphagia or difficulty in swallowing, unusual bleeding or discharge, especially the vaginal bleeding, which occurs between the usual menstrual cycle, between the menstrual periods, and after menopause, after 60 years of age, if someone has attained menopause like 10 years back and if they are experiencing bleeding, then definitely yes. And after intercourse also, right? So blood in urine or stool, unexplained bleeding from any of the body opening or orifices. For example, let us assume it is nose or ear or anal canal, or during urine, or wherever it is, or even from nipples, wherever it is. Then the skin changes like a mole that changes in the size, shape, color, or has irregular borders. A new mole or a new skin lesion occurring in any part of the body. Sore throat, yellowish skin and eyes, which is usually jaundice, especially in pancreas cancer or some liver cancer. You might find in pancreas cancer, especially when the head of cancer, pancreas has a cancer, it might go and obstruct the path of drainage of the bile. So hence we might experience jaundice. So darkening of the skin, hyperpigmentation, persistent and unexplained pain, persistent fever or night sweats. So the specific symptoms for the common cancers, let us see. Like for breast cancer, you might have lump, changes in the size and shape of the breast, skin changes, dimpling. Dimpling means like the skin will change like orange peel, where it has some dots separated by a elevation, right? Like that. And redness, scaling or thickening, nipple discharge or retraction, and persistent breast pain. So pain is different, definitely not our enemy. It is actually good, because most of the people, they might have lumps 3 centimeter, 5 centimeter, or even bigger lumps. Unless and until there is pain, they will never go and seek attention for the tissue. Till the time they are disturbed because of pain, they will never seek medical attention for any of the problems. So it's good that the pain comes, and hence they seek the medical attention and they make a diagnosis of what the disease they are suffering from. And the next one is the oral cancer, where you have persistent sore throat or any sore or ulcer or in the mouth, which is lasting for 2 to 3 weeks, or reddish or whitish plaque, which we have explained in the yesterday's video, which is called as the pre-malignant lesions in the oral cavity, which is leukoplakia and erythroplakia inside the mouth or tongues or your gums or your lips, that doesn't heal within 2 to 3 weeks. So difficulty in chewing, swallowing, moving the jaw or the tongue, or any lump in the neck or the oral cavity. So then comes the cervical cancer, vaginal bleeding. I have explained in the three scenarios where you have bleeding after menopause, or bleeding in between the menstrual cycles, or bleeding after coitus or sexual intercourse. So unusual vaginal discharge, either it is watery or bloody or foul smelling. So pelvic pain or pain during the sexual intercourses, and especially in cervical cancer, in not only in cervical cancer, in most of the cancers in the early stage there might not be any symptoms. That's why in cervical cancer screening for the pap smear is very important to diagnose it early. That's where the role of screening is. That's why I have made a video about screening in yesterday's video, where why screening is important to diagnose the disease earlier. And the fourth one is the colorectal cancer or the bowel cancer. The persistent change in the bowel habits, like new constipation or diarrhea, lasting for few weeks. The most important thing is it should last for few weeks. Like you had diarrhea for few weeks, like you had diarrhea for 1 week, that might be because of infection. You would have eaten outside or something else like that. That doesn't necessarily mean that you might have cancer. So blood in stools, bright red, black or tarry. Persistent abdominal discomfort like cramps, gas or pain, a feeling that your bowel doesn't empty completely. And the fifth one is the lung cancer, new cough that gets worse day by day, coughing up for blood, chest pain that worsens with deep breathing, coughing and laughing, shortness of breath or wheezing, hoarseness of voice, weight loss and loss of appetite, recurrent lung infections. The next one is the prostate cancer, where you might experience any trouble in urinating, like store steam or weak steam, passing urine for quite a prolonged time, need to urinate more frequently because like your bladder is not emptied completely because of the obstruction. Only partially urine has emptied, so rest of the partial urine is already in the bladder, so it gets filled very faster, so you have the need to urinate more often. So this is more significant, especially in the night while we are sleeping. So pain or burning during urination, blood in urine or semen, and persistent pain in the back, hips or pelvis. So the important things, right now we have seen the symptoms of the cancer. Most of the people who are watching this video, they might have some symptom or the other. Right now you might ask me like, I have these symptoms, will I have cancer? Definitely not. So you need not be worried. For example, let us see like trouble in urinating. If you have prostatomegaly also, you will experience the same symptoms because that is also a lump in the prostate which is obstructing the path of urination. So if you have a shortness of breath or wheezing also, that might be because of asthma also. Like for each and everything, there are thousands of differential diagnosis which is available. So these symptoms definitely doesn't mean that you might have cancer, but if these symptoms, if they are persisting, it means that you should definitely get a medical attention which will help you to rule out any cancer if you have, or if you don't have cancer, if it is other disease, that also needs to be treated, right? So, and the second thing is, don't self-diagnose. Right now I have told all these things. Right now you might see the prostate cancer part and you will see all these symptoms I have. So right now I have prostate cancer. No, nothing like that. It may be because of prostatomegaly also, as I said earlier. So don't self-diagnose. If you put in Google now, so all these symptoms will say you might be probably having cancer. So this, many of my friends have called me and asked me like, I have these symptoms. I googled it and it showed cancer. Do I have cancer? No, definitely not. It might not be possible. So that's why you have to seek medical attention. So, and there should not be any shame or delay. If you have some symptoms, you should not be saying, I have this function this time, I have my son's marriage, I have that thing, this thing, and you should never delay seeking medical attention, one thing. And there should not be any sin. For example, if you have some discharge from the breast, you should not be feeling shameful to discuss with your husband, or if you have post-coital, post-intercourse bleeding, you should not be feeling shameful to discuss about these things. These are normal things which should be discussed, and people should seek medical attention for such things. And especially listen to your body. If your body says some symptoms, it is an early warning and you make attention to it. So the image which you are seeing nearby, why I have put this video is like, because in yesterday's video I was telling about a Mataji who came to the OPD very late at the end stages. So this old lady, she came to me. So obviously on seeing her, you will find there is one breast and the other breast is not there. So what they said is like, I asked like, give me the discharge summary and details about the surgery which has been done. They said no, no, no. We have come to the hospital for the very first time. So far there has been no illness, and this is the first time. Then I'm saying like, where is the other breast? It might have been removed surgically. They said no, no, no. It was like necrotized. It was with so much of dead tissue. The doctors did debridement, and during debridement the entire lump got out. This is what they are saying. So it was quite, I have never heard about such cases, so it was quite unbelievable for me. Then I said like, show me, I want to see. Then when I saw, there was no surgical scars or incisions or stitches or nothing like that. The wound was like this, and they are saying with this wound, this mother was staying in the house for a quite long time. So this is the scenario in the, especially in the Indian setting, especially women. They tolerate pain, they tolerate any lumps, they tolerate any wounds they have. They don't tell to anyone unless and until it becomes so much of foul smelling, unless and until it wets your the dress which you are wearing. They never seek medical attention. No one is least bothered about the women, especially the older women who are staying inside the house. This should not be the scenario. You should identify things very very early, right? That's how you can diagnose the things early, you can get treated better. So I have so many photos like this, but if I share so many photos, the people who are watching this video, they might also not feel comfortable, right? That's why I'm not sharing so much of the video. So I hope this video was useful for you. If you have any doubts, please do leave it in comments. I will reply all the comments. And apart from that, if you would like to hear about any other specific things related to cancer also, please do leave it in comment, so that I can make such things in add all your queries in the upcoming videos, which will be useful for you. I hope this video was useful for you. I will see you in one another useful video like this. Until then, it's Dr. Aravind signing off. Om Shakti.